Hello, I'm Sean Fletcher and welcome to a special edition of Inside Out London, in which we investigate the shocking truth behind the drug sodium valproate. It's a medication that's widely used as a treatment for epilepsy, but for pregnant women there can be dangerous side effects. And in the past, many mums-to-be have taken it completely unaware of the mental and physical damage it was doing to their unborn children. In this programme, we reveal that the authorities were fully aware of the dangers the drug presented, but deliberately chose not to inform pregnant patients. And we present new evidence that tragically suggests that the drug's harmful effects can be transmitted through generations of the same family. Tara Welsh has this exclusive report.
Deformed, disabled, damaged. Thousands of babies around the world genetically harmed in the womb by one drug.
She can't go to the toilet, she can't walk, she can't talk.
We bring to light the records that show the government knew the drug causes birth defects, yet chose to hide the truth from expectant mothers.
My mum shouldn't have had to have the children that were affected if she knew that we were going to have these conditions.
Now, new scientific research warns sodium valproate's toxic legacy could be eternal, harming generation after generation.
It's because I took that medication. My grandkids have been affected by it. So many people's lives have been affected and ruined.
Well, this is all her fit medicine. This one here, I have to give her 3 times a day. This one twice a day, and this one twice a day.
Every morning, first thing, Karen carefully measures out the exact amount of medicine needed to keep her daughter alive, to save her from falling into a fatal coma.
Bridget got hiccups. You're going to swallow it. I know, it's horrible. You got to swallow it, though.
Bridget is 19. She still plays with some of the toys she had as a baby.
This is the photo album I done for Bridget when we came home. Pictures of her in a cart with her toys around because she could only just lay there still with her head to the side.
Bridget was born with a catastrophic array of medical ailments, including brain damage and spina bifida. She's paralysed from the waist down. Even her bowels aren't fully formed.
She can't go to the toilet, she can't walk, she can't talk. She can't think for herself. I do all Bridget's overall care. I think for Bridget, I talk for Bridget, I walk for Bridget, I live for Bridget.
When Karen was pregnant with Bridget, she was prescribed a high dosage of the drug sodium valproate. She has epilepsy, and the pills were meant to control the seizures. But the powerful chemicals that protected her health damaged her daughter's.
I pop these tablets into my system, and what happens? 6 months down the line, I'm under antenatal treatment, and then they turn around and look at me, look at the screen, and turn around and say to me, what do you want to do? You want to have an abortion, you're carrying a spina bifida baby.
Like Bridget, around 20,000 children in the UK and thousands of others around the world are believed to have fetal valproate syndrome after being exposed to the powerful drug valproic acid in the womb. Some of the children are so severely harmed they'll never develop beyond the mental capabilities of a toddler. Others may appear fine, but will struggle with cognitive and physical disabilities throughout their lives.
We know from our research that children who are exposed to sodium valproate can be affected physically, they can be affected mentally, and they can be affected psychologically.
These children have an increased risk of cleft palate, and these children are more prone to spina bifida or neural tube defect. We also know that there's an increased risk of congenital heart disease and occasionally an increased risk of kidney abnormalities.
Concentrate.
At her school in Essex, 7-year-old Beau attends special PE classes to improve her motor skills and her ability to interact with others.
Right, let's try and get your arms straight. That's a good girl.
3, 4, 5.
That's enough? Perfect. I've never worked with a child with fetal valproate syndrome before. Beau finds a lot of things challenging. She's actually got a diagnosis of ADHD. She also, we feel, has got problems with her coordination, so that's being looked into in terms of possible dyspraxia. Can you try with your other hand and your other foot?
At school, Beau needs special different treatment to the other kids, but at home, she's just one of 3 sisters all struggling with health problems caused by fetal valproate syndrome.
I don't know if it was like denial, but I didn't. When you see your children every day, you don't see them as being different. They're just your children, and for someone to say, "Oh, there's something wrong with your child," you think, "No, they're fine. They're perfect." But obviously there is issues, and obviously they need extra help. You know, it's hard.
Their eldest daughter, 16-year-old Devon, needs to be constantly watched over. She suffers from reflex syncope, a condition which can restrict blood supply to the brain.
I think I'm a bit slower than other children. I'm slower and like writing than others. I get extra time when I do exams because it takes me like a long time to understand what the question means.
Devon's younger sister, 11-year-old Sienna, is the sibling most affected by the syndrome, leaving her with mental and physical impairments.
It affects me, so then I get really stressed out. I either start making just loads of noises, or I just start screaming, like screaming or crying, because then it's just too much for me.
She has accidents. It's not every single night she has an accident, but there's some kind of leakage every day. She's got this condition because of the medication that I was taking whilst I was pregnant with her. She's incontinent and she soils as well. This is something that will go on with her for the rest of her life.
As a remedy for her epilepsy, Leanne has always been prescribed sodium valproate. Yet both she and her husband say they were never fully warned that taking the drug whilst pregnant could damage their children.
We wasn't told, no way, shape or form, that this would happen to us. There was no guidelines, there was no information, there was nothing. This is a drug that is being prescribed from a doctor, and this is what happened. We're the ones living with the consequences.
Since the anti-epilepsy drug was launched in the 1960s under various brand names, it's estimated that tens of thousands of women around the world have taken it during their pregnancies, unaware of the dangers. Karen is one of them.
I didn't think my child was going to be like how she is today. If I had known when Bridgie was inside me, if I had known now what I knew back then, I wouldn't have had my child.
Emma and Janet also took sodium valproate during their pregnancies. They say they weren't aware of any warnings and were given no indication of the danger by their doctors.
He didn't even tell me really to an effect that I had epilepsy to start with. When I got my first prescription, there was no warnings in the boxes at that point. I mean, we're talking 83, 84. So there was nothing for me at all.
My husband and I questioned the midwives, questioned neurologists, and to just be told, take this medicine, it's the best to control your seizures. That's great to control the seizures, but the baby.
After their children were born with disabilities, they set up a charity to raise awareness.
We started our national campaign in 2013, and the main aim was to get warnings onto the boxes, onto the patient information leaflet.
Partly as a result of their campaign in 2016, the Medicines and Healthcare Products Regulatory Agency recommended that warning labels should be featured on all valproate-containing medicines. GPs must only prescribe the drug to women of childbearing age as a last option after explaining all the risks. But why has it taken 50 years to get the warning out? In the UK, the government regulates what information is provided to patients, and according to Emma and Janet, it knew about the dangers of the drug as far back as 1973. They discovered the evidence deep in the National Archives.
There we go. That statement similar to that proposed by ICI could be included on all relevant data sheets but not on packaging inserts. So there would be no danger of the patients themselves seeing it.
If they hadn't have made this decision?
Yeah.
You'd have been warned?
I'd have been warned, and probably the boys wouldn't have been harmed like they were.
The 20,000 affected?
Yeah.
There wouldn't be that today?
No.
It's an extraordinary scandal. Since the very start of its licensing in this country, there was a knowledge of risk, and yet a decision taken to hide that risk from mothers. A totally sort of paternalistic approach that mothers might worry about it. Well, of course, mothers have a right to know.
In a statement, the Medicines and Healthcare Products Regulatory Agency said,
"At the time, according to clinical practice, it was for the doctor to decide how much information a patient was given about their medicine. Since then, the need for patients to be fully informed about their medicine has been underpinned by legislation."
But charities say the system of warning patients is proving ineffective. Over the last year, hundreds of babies around the world have been born with sodium valproate syndrome. Many pharmacists and health centres are still issuing the drug in generic packaging with no warnings.
We are now here in 2018 and the scenario is that women are still given white boxes in which there are no warnings, there is absolutely nothing on them.
The fact that women are still not being made fully aware of the risk is particularly alarming because among the affected families there's growing fear that fetal valproate syndrome is actually being passed on through the genes from one generation to the next.
You'll fall down? Yeah?
3 generations of the same family. Here today, a grandma, 2 grown-up daughters and their kids. Fetal valproate syndrome has dominated their lives.
It's because I took that medication. That's why my kids haven't got a normal life and they struggle every single day of their life to fit in and do things. One of my kids couldn't cope and tried to hang themselves. If I'd have known with my first couple of children that they'd have had this syndrome, I could have then made that decision whether to go on and have more children.
Sue took the drug Epilim throughout her pregnancies. She only discovered it had harmed her children after a doctor visited her at home.
I have big poster pictures up on my wall of my kids when they were little. And she just, as soon as she walked into the room and she's seen the pictures and she said, "Are these the children?" And I said, "Yeah." She said, "They've definitely got the syndrome." It was, they had the facial features, the high forehead, the upturned nose, and then an appointment was arranged for all the children and myself to go down to Exeter to have genetic testing done and all other kinds of tests done, and it was confirmed.
Despite their difficulties, Sue's daughters now have children of their own.
Look!
In the past, Natalie was prescribed sodium valproate to control her epilepsy, but she says she stopped taking the pills when she was pregnant. Tanya has never taken the drug, yet both sisters believe their children are displaying symptoms of fetal valproate syndrome.
Certain things that they're doing, like the behaviour ways, the way they're speaking. Give me the book. It's just certain things. I'm like, I remember doing things like that when I was a kid. My little boy's 9. He's got dyspraxia, learning difficulties, a bowel condition, sensory issues, memory problems. I've got 2 children, both have got dyslexia. My daughter's got dyslexia and dyscalculus. And she's in special needs school.
Whilst researching this film, we spoke to several families who suspect that sodium valproate is somehow not just harming their children, but their grandchildren too. Until now, those suspicions have not been deemed credible. But we've obtained the results of a major scientific project in South Korea, which actually supports the idea that the drug can harm successive generations. Chan Young-shing, a professor of pharmacology, is leading the research that uses pregnant mice injected with the compound. What does your research actually prove?
They're giving the indication or one of the evidence that this chemical could cause the autism spectrum disorder transgenerationally through degeneration. It can give us some kind of a clue that the same thing is happening to humans. So it's a kind of a warning signal.
The experiment indicates that sodium valproate can travel through DNA and afflict successive generations with mental health problems. In the UK, the findings are being carefully considered by the government and have already triggered concern amongst experts on fetal valproate syndrome. Dr. Rebecca Bromley is a leading neuroscientist, and she believes the need for more research in this area is urgent.
That was the first bit of evidence that we had in any species that potentially this can be carried on to the next generation. Before this paper came out, we just didn't know. We had no evidence that it was going to be something that was an issue, and we were still learning about the longer term effects on the individual who'd been exposed directly to the drug. This is something now that needs to be looked at as quickly as possible to give families some reassurance.
The consequences are incalculable. How extraordinarily distressing this must be for the families affected. The knowledge that this is now within the DNA of that family and potentially transferable from generation to generation.
At home in Liverpool, Tanya and Natasha want to get their children formally diagnosed, but like many families, they're struggling to find a doctor who even knows the syndrome exists.
I went to the doctor the other day and I asked my doctor a question and I said, can you tell me about, is there a possibility that this could be a part of my facts? My GP turned around and said, sorry, what's facts? And I was like, oh, I have to keep on repeating myself and I shouldn't have to do that. I said, I shouldn't have to be your teacher, and I walked out the room. I thought, that's not my place to explain to you what facts is. You read my notes.
Couples that have come to see me in the southwest of England, some have really struggled to get their GP to refer them. I know that for a fact.
I can just stand down next to Mum and we'll try and measure your head.
It partly depends on really the first hurdle, if you like, whether their family doctor or GP has some knowledge or awareness of the condition at all.
Back in London, Bridget is becoming weaker. The drugs are no longer working.
Her brain is brain damaged, so she's only got one part of her brain that works. A neurologist doctor's turned around and said that they can't give her no more medication, no more. She has different kinds of seizures, and now she could die any day.
Yes, I love you. Yes.
Karen says Bridget isn't expected to survive beyond a few more months and insists that when that fatal moment comes, she must be allowed to die in peace.
If she was to stop breathing, she is not to be resuscitated. She is to be rest in peace. No one will bring her back alive. That's what these letters say on this door. It will be more of a relief for me as a mother to let my little girl rest in peace, knowing that every day I see my little girl having a seizure in so much pain as I do, that's more painful to watch than seeing my little girl probably go from me and to be at peace.
Really?
Today, Tanya and Natasha are heading to Liverpool's Walton Health Centre. They want to get their children assessed for fetal valproate syndrome.
I'm a little bit anxious to know what's going to happen and what he's going to say. I just think we need to know whether these have got the syndrome, because if these have got it and we haven't took the medication, if these have got it, so is it going to get passed down to their children? Is it going to stay in the family for as long as the family carries on?
I'd like you to try this next one for me, please.
Neuropsychologist Professor Gus Baker is the lead author of the most comprehensive research programme ever conducted into children born to mothers with epilepsy.
We've actually looked at the children from birth and followed them up over a 6-year period, assessing their development, their neurodevelopment in terms of how well their brains are working, their development of their language, their memory and their intellect.
So talk us through the assessment. What are you going to do today exactly?
What I want to be looking at is how this young boy is developing.
Hello. Hi.
Hi. The first one is really straightforward, is can you write your name for me? Good, okay. I'll be trying to get an overall picture of how he's developing in relation to how, for example, his peers are developing. Can you draw me a house? Okay?
I am pretty good at drawing houses.
How many bedrooms has it got upstairs?
2.
2 bedrooms.
And I've drawn some flowers and leaves and gate and a path.
So I know you can't give us a definitive diagnosis, but what are your thoughts after that assessment?
Well, obviously it's going to take me a little while to score up the test results, but when I've done that, I'll be looking at his strengths and weaknesses, and I'll be identifying them and trying to map them on to what we understand about sodium valproate and how it affects children. And then I'll probably be in a good position to provide a formulation of what I think has happened to him and what we might be able to do to ameliorate those difficulties that he's clearly having.
Even though it could be years before the full extent to which her grandchildren are affected is known, Sue believes the drug she first took nearly 4 decades ago has caused infinite damage to her family's lineage.
I do think my grandkids have been affected by it. I've had my worry with my kids growing up. I've got the worry again with my grandkids. How long is it going to go on for? It's not fair at all. It's not fair. It's so wrong. So many people's lives have been affected and ruined.
The transgenerational impact of fetal valproate syndrome could potentially remain with families for centuries. And as the first generation of children born with the condition mature into adults, there's growing demand that the government should pay for their care and support. In France, a charity-led campaign for compensation is being supported by the government.
The government decided to create a special fund to help victims. There is a fund that is organizing all the expertise, appoint the doctors and pay the doctors, and who are going to say who will have to pay.
Until now, a campaign in the UK for compensation to help affected children has failed to receive any government backing. But recently, the Department of Health has initiated a conversation with charities and key MPs who have been fighting for a public inquiry.
We are in a good dialogue. The Minister, Lord O'Shaughnessy, appears to have taken this very seriously, is willing to engage with us. He appears to be completely conscious of the need to stop this scandal continuing and the need to recognise what's happening in France. Something similar has to happen here, and without delay.
Unbelievable that the English democracy does not work properly and does not help the people. The people must put pressure on their government for that.
It's a rallying call that charities in the UK are championing. Emma and Janet are at the forefront of the campaign.
The care package is more important because of the transgeneral link now. The fact that our grandchildren could be affected, you know, with neurodevelopment disorders, possible heart malformations, they need care and support.
For us, it is a government issue. The government have to take responsibility on that matter and make sure that these children are fully looked after. As a parent in particular, my two are a lot older now, they're in their 20s, and it's a worrying factor for me because I'm not always going to be here to take care of the kids, and, you know, to live an independent life is going to be really, really difficult for them.
Janet's 2 grown-up sons, both of whom suffer with the syndrome, are completely dependent and still live at home. Philip is more seriously affected.
I'm 25 now and symptoms are I can't concentrate for very long. I've got when I go outside, my social interaction is zero, and I'm very apprehensive with going anywhere really.
Both of Janet's sons have suffered with neurological problems since birth, and 2 years ago, doctors discovered that Philip, like many maturing sufferers of fetal valproate syndrome, had developed yet another condition.
After I've finished my college course, I've been for 8 years. I was diagnosed with epilepsy, stress-related epilepsy, and it's really hard for me to. It's really hard to. Yeah, it's hard for me to describe the symptoms, but I know it's really, really difficult to live with.
I think it's disgusting the way the government are acting. I think they should pay compensation to all these babies that have grown up now to young adults that are struggling.
It goes...
Any kind of apology or compensation might come too late to help children like Bridget.
It breaks my heart. I've picked this plot because it's a lovely cemetery. I didn't want to choose a cemetery yet, but because of how my daughter's deteriorating so rapidly, I needed to do it because I won't be able to do it once she does pass away. Mothers shouldn't have to bury their daughter. No mother should do that. My family, we're mourning now and will be the day like I lose my little girl.
Tara Welsh there with that special report. And if you're currently taking sodium valproate, then please do consult your doctor before making any changes to your prescription. Right, that's just about it for this week's Inside Out. Before we go though, let's have a quick look at what's coming up on next week's show.
London is getting noisier. Could living in the capital be putting your hearing at risk?
So this is the Victoria line heading towards Stockwell, and it's absolutely deafening.
The fight to get fit. We set one family the challenge of being more active.
We need to work as a family to motivate each other to go outside and do these sports.
And what's a working windmill doing in Brixton?
It's really special to be in a building. It's as much as it was 200 years ago, using these heavy iron mechanics. It's incredible to see what we were able to achieve 200 years ago.
And that's it for this week's Inside Out. Tonight's programme will be available on the iPlayer. Just head to our website, bbc.co.uk/Inside Out, and click on London. Thanks very much for watching. See you again next week.